welcome to Medical Dialogues show. I am Dr. Nandita Mohan and I am here today to talk about the Congenital Heart Defect Awareness Week that is observed from 7th to 14th of February every year. Now, the campaign that I'm going to talk to you all about basically aims to raise awareness and also to educate people about the congenital heart defect, which is a lethal constellation of birth defects that actually affects your heart. Now, to talk to us in detail and also to give us more insights on this topic, we have with us today Dr. Bipin Dubey, who's a pediatric cardiologist who's joined us to give more valuable insights on this topic. Welcome to Medical Dialogue, sir. We are really happy to have you on board here with us today.
Thank you.
So, sir, as we are talking about the congenital defect cardiac awareness, congenital awareness week, so firstly, if you could just explain to our viewers what, according to you, are the early warning signs of congenital heart disease? What is your take on it?
Yeah, there are two types of, broadly speaking, two types of congenital heart disease. One is called cyanotic congenital heart disease, and another is a acyanotic congenital heart disease. Cyanotic congenital heart disease means the baby is having a blue coloration of his fingers, face, and extremities. So that is one group, and the second group is a acyanotic, means in that the baby will looks like normal, no cyanosis, no discoloration of the baby, but they may have some breathlessness and other. First of all, we'll talk about the cyanotic congenital heart disease. In cyanotic congenital heart disease, babies are usually looking blue, and if they are crying, they become totally breathless. So, and sometimes extreme of that, they may have convulsions also. So the earliest sign in this group is the discoloration of the baby, and he looks blue type of discoloration. So that is one. And if he is having if the baby is crying, so definitely yes, he will have extreme breathlessness, and in extreme cases, patients may have some convulsions. If you look at their fingers and palm and upper and lower extremities, and especially the tongue and lips, all of them are blue. So this is one group of the patient, and it's a common one also. The second is called acyanotic congenital heart disease. In this group, the patient does not have any discoloration. He looks like pink, normal. And in this group of the patients, the usual symptoms are the breathlessness. Whenever the child is taking a breast, if the children are very small, like infants or neonates or something like that, and if they are taking a feed like any kind of the feed, the breathlessness increases. And in that situation, the patients have, if the babies are crying, or if any kind of exertion is there, like passing motions and other, the patients becomes more breathless. So in this, this group, there are so many congenital disease is responsible for acyanotic congenital heart disease. The commonest among is called the VSD, ASD, and PDA. These three things are there. VSD means there is a hole in the heart, and the hole is between the left and right ventricles. That is called ventricular septal defect. This is the common one. The another is called ASD, atrial septal defect. In this, there is a communication between the left side of atria and right side of atria. And third is called the PDA, patent ductus arteriosus. In this, there is a communication in the great vessels, means the vessels which is taking blood from the right side of the heart and giving it to the lungs, and from the lungs, the blood is coming to the left side of the heart through the pulmonary veins. So there is no communication between the arteries and veins. In PDA, there is a communication between the between the artery and pulmonary artery and aorta. This is called PDA. PDA is usually normal phenomena in the neonatal stage and in the prenatal stage. So in fetal stage, because in that in fetal stage, because the lungs is collapsed, so the blood is not going through the lungs. It is coming from the right heart to the aorta directly. So this is called PDA. So after birth, this PDA usually gets closed after some times. But in some cases, if this duct is very large, it's not possible to close, and that creates problem. So this is the three groups. In all these three groups, breathlessness is the main sign, which increases during exertion, like feeding or passing the motion, or stool, or when the child is crying. So this symptoms is the main symptoms. And the second is that recurrent upper respiratory tract infection. So children are very prone for the respiratory tract infection, and if any child is having recurrent infection, we have to think that there may be some hole in the heart. So in that case, you should always contact your pediatrician or your cardiologist to see the child. So these are the two groups of the common congenital heart disease, cyanotic and acyanotic.
Great. Thank you so much for that insight, sir. Definitely, you explained the three different types which are very commonly seen. So now that we're talking about this in detail, how do you feel that the congenital heart conditions, they differ across different age groups? And if you could just elaborate on the ways that we can actually use to manage them.
First of all, we'll talk about the acyanotic congenital heart disease. If the patient is having a ASD, means hole between the two sides of the left and right atria. So by and large, secondum ASD, these patients are asymptomatic for quite a longer time. Maybe patient will have symptoms apart from this recurrent respiratory tract infection. Breathlessness usually comes later. So maybe in the later childhood or teenage group, or in extreme cases, patients may have breathlessness in second and third decades. So usually this breathlessness happens during exertions. So this is for the ASD. If the patient is having VSD, majority of the VSD, around 70% are getting closed if it is a perimembranous VSD. Remaining some of the VSDs continue through the lives. In this also, if the VSD is of the large size, then the same symptoms, recurrent pulmonary, recurrent chest infection followed by breathlessness. So if it is very large, usually it occurs, the symptoms occurs a little earlier during the childhood, and maximum of the VSD is very big. The patient may have symptoms in 5 years, 6 years, or 7 years age also. If it is a very, very large, then patient may have the symptoms just after the birth or neonatal periods. So this is the VSD. For PDA also, usually the symptoms occurs in the early childhood. If it is large, if it is a small, it keeps quiet for a long time. So, and the symptoms are the same for all the three. How to differentiate between the three? You have to go for the echo, ECG, and X-ray chest and other investigations. That is these investigations are very important if we are suspecting hole in the heart. So that is one group. So suppose if the patient is having cyanotic congenital heart disease, usually cyanotic congenital heart disease, cyanosis means discoloration, usually occurs in the early age of the child. So as the child grows older, this cyanosis usually increases, and there are some changes in the fingers also, that is called clubbing. And in this case, the patient does not have recurrent chest infection, but definitely yes, breathlessness is there. And that breathlessness is extreme breathlessness patients have, and extreme discoloration also patients may have. So usually cyanotic congenital heart disease, they present early as compared to the acyanotic heart disease. If very large VSD, ASD is there, then patient may have symptoms in the early childhood.
Understood, sir. So now talking about the different age groups, you also explained to them the treatment aspect also. So if you could just enlighten on how has medical technology, which is advanced in the diagnosis and the treatment of congenital heart defects?
So for the if you are suspecting the congenital heart disease, cyanotic or acyanotic, it's very easier to differentiate between that. And if you are talking about the investigation, so first of all, ECG is the first, X-ray second, and third is the echocardiography. Echocardiography is a very, very important tool which will clearly show you where is the hole, whether it is between the atrias, or it is between the ventricle, or it is a patent ductus arteriosus, or maybe TOF, and so many other diseases are there which is responsible for the cyanosis in the child. So everything you can easily find out in the echo. But as I told you, the first investigation is always ECG and X-ray, and followed by the echocardiography. This is the sequence how we are doing the investigation in this age group of the patients. And after that, the patients are supposed to go for the cath study also if it is required. Earlier, we used to do cath study in all type of the congenital heart diseases to find out the pressure differences between the left side heart, right side heart, and so many things like oximetry we are used to do. But the high quality of the echo machines and well trained echocardiographers nowadays, this much of cardiac catheterization is not required. So about the treatment, so earlier all congenital heart disease, especially the acyanotic congenital heart disease, the only surgery used to be the options for that open heart surgery. That is called uh, uh, heart repair, congenital heart repair, what we are calling in that. So that's the role of the surgeon there. Nowadays, there are so many devices are available which can be deployed without opening the chest. Like if the patient is having VSD, that can be closed by the VSD device closure, just like we are doing the angiography and those things, other interventions. So this is also possible. Secondly, the ASD also, ASD device closure is also possible. And the third one, that is called PDA, that can also be closed completely by devices. And this technology is widely available. And in India, all metro cities and even the second tier cities, our pediatric cardiologists, they are doing the closure of the ASD, VSD without opening chest by various kinds of the device. So this is a very good newer things which has come in last 2 decades and very popular also. Very simple and easier. No cut, no chest opening. So this is a good technology which is available across our country, across the globe. The second is like acyanotic congenital heart disease. In that, cyanotic congenital heart disease. Majority of the cyanotic congenital heart disease, open heart surgery is required, and almost at least I can say maybe 80 or 90% of the congenital heart disease, cyanotic congenital heart disease, can be taken care by open heart surgery. That is called cardiac intracardiac repair, ICR. So these are the way to treat them. And this is the definitive treatment. Apart from that, if you talk about the medical treatment, if left to right shunt is there, like VSD, ASD, PDA, we have to control the recurrent chest infection. We have to control the cardiac failures. So for cardiac failures, so many drugs are diuretics and other drugs are available, which can be used in this type of the cases.
That was a wonderful explanation, sir. You've given us the technological advancements, and definitely now that it's been carried out for the past 2 decades, then it's definitely a commendable development, I would say. Now we're talking about the latest developments. Now, if I also would want to highlight on how do advancements in genetic research basically contribute to our understanding of the genetic factors that are influencing the congenital heart defects. So what is genetic research? What role does that has to play?
So many genetics markers now research is still going on and it is not yet completed. But there are so many things you can, just like if some patient is having VSD or ASD, this type of the congenital defects, they runs in the family also. So if you have the large size of the ASD, you have to screen your other children's also and the grandchildren's also to find out whether these things are there. As far as the genetic markers are concerned, these genetic markers are still in the investigations phase, and definitely we do not have much these markers so that we can do, but definitely yes, there is a large progress is going on in this. Probably in coming decades we will have so many genetic markers which can say about the future of the offsprings.
Great. So, lastly, just to conclude, sir, if you could just explain the long term impact of congenital heart defects on an individual's quality of life. How does it affect the quality?
First of all, the early detection of the congenital heart disease is a key. So, if some child in the early age, we are able to find out whether the children are having VSD, ASD, and PDA. If in early age, if VSD, ASD, PDA are either closed by the surgically or by various kinds of the device, these results are very good, and long term effect is also very good. Similarly, if some patient is having blue baby syndrome, what we are calling is a cyanotic congenital heart disease, early repair is always a better. So many like cyanotic congenital heart disease are there where the results are very good, and the child may survive for the decades and decades. So one of them is tetralogy of Fallot. In that condition, if the repair is done in the early stage of the child, so long term this prognosis is very good. Similarly, but there are few complex congenital heart diseases. In that case, the prognosis is good, but not as good as fellow of tetralogy. And for the left to right shunt, the excellent prognosis is there. So if these things are treated early, suppose if patient is not treated for the VSD, large VSD, SD, PDA, and the child has grown up to more than 20 years or 30 years, once the pulmonary hypertension develops and right to left shunt starts, then the prognosis, what we are calling as a Eisenmenger, in that case, prognosis is not good. Only some medical treatment is possible, but long-term prognosis is bad.
Okay, so thank you so much, Dr. Bipin, for giving us all your valuable insights. It was lovely to be interacting you and interviewing you today, and thank you for giving us your valuable time.
Thank you, thank you, thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.